So here we are at St. John's, and this is a beautiful campus in the heart of Bangalore city. We have over 120 elective students who come from all over the world but want to come to India to get their hands dirty, as well as get a feel of what rural and urban poor healthcare is all about.
Honestly, I've always wanted to come to India. I think my first couple days, this massive city was pretty overwhelming. Now that I'm used to it, it doesn't faze me. I could see myself living here long term. I wouldn't have a problem with that.
So I live in an apartment complex close to St. John's Medical College. I've been in internal medicine and nephrology, so rounds start around 9 o'clock, go patient by patient. Sometimes you're in a large room with 15 patients, no separation between them or no dividers.
I've been in ophthalmology for a few weeks now, so most of the days is outpatient department. So we get there, we see a large number of patients, then we have a little break and there's an afternoon clinic.
So that's typically about 3 doctors working in one room. So you got 3 different patients going on in a very small space. It's very hectic, but very good learning opportunity. So they run through about 30 patients in one afternoon.
All of this is being done on paper. There are no computers being used on rounds. Charting is done on paper and in binders. So on the days that we have community health, we generally try to be at the hospital by 8:30 so that we can take the shuttle. It's about an hour drive to the villages, but until 1 o'clock we're at the village. So each day that we go to the clinic is focused on a different specialty. Like this week was ophthalmology on Tuesday, geriatrics on Wednesday, maternal child health on Thursday, and psychiatry on Friday.
In the hospital, with ophthalmology especially, I get to do a bunch of eye exams, which is great practice. A quick, eyelid checks, something really small. Get to do a bunch of things like that. During surgery, I don't get to scrub in or do anything like that, but I do get to observe under the second microscope that's next to the surgeon. And most of the time, surgeon's explaining what's happening. Is very happy to do that.
You have such a massive volume of patients that sure, you see a lot of interesting cases or abnormal presentations of this and this illness, just from the sheer volume that you're seeing. But I think primarily what you take away from this is just, how they run their healthcare system here.
We generally try to take the Sundays to go out and visit different places that seem interesting to us. We've been to the Bangalore Palace, the Botanic Garden, and transportation is fairly inexpensive. A lot of people speak English. It's very easy to get around and ask for help or directions.
We have a sizable urban poor population, as well as we have a close proximity to a rural folk which have their own cultural and social traditions that affect healthcare. So students who come to us from overseas get to see both the best of urban and rural health problems, as well as how we manage them.